Hey, it's Mrs. Durham here. I already have my gloves on because we're going to talk about injections today. I'm going to try to go through it relatively quickly because you've all seen it in Skills Lab. I just wanted to make sure you saw the skill a little more closely. My equipment might look a little bit different, but I'm going to go through the things that you have in your bag. For starters, you're going to have 3 different size syringes. So this is kind of important. I'm going to see what you can see here. We need our syringe size here for our volume. I don't know if you can see our volume max here. Depending on our route, we have different volumes that we can use for our injections. So we see here for our ID injection, we can only use a 0.1 ml. In sub-Q, you're usually going to see about 1 milliliter. It can take more. This just depends on how much adipose tissue this patient might have. So oftentimes you can give up to 2, but typically what you're going to see is 1 milliliter or less than. And in our IM injections, we have different volumes that can be given in different muscles. So our deltoid muscle can only hold 1 ml. Our ventral gluteal muscle is going to hold 1 to 3 mLs. And then our vastus lateralis on the side of our thigh can hold up to 5 ml. So 3 to 5 mLs on that thigh there. And of course, depending on our route, we're going to be choosing different needle sizes, and we'll get to those in just a second. So again, back to our syringes, we have different syringes because it depends on the volume that we're going to need. You always want to choose the syringe, the smallest syringe, to get more accuracy. So in Skills Lab, you're going to see insulin syringes passed around, a 50 unit and a 100 unit. And when you look at that, you're going to see the tick marks are very, very tiny. So to get more accuracy, I need the smallest syringe that has a more visible little tick line on it, a line for me to choose from. So in my packaging here, you're going to have a 1 ml, a 3 ml, and you're also going to have a 5 ml that I don't have right now. So I don't need it. I'm not going to draw anything up with it, but all your packaging is going to look like this. This is your 3 ml, and of course I can look on here to see it's a 3 ml again, or if it's a 5 ml, or it's a 1, but my packaging is also going to tell me this one is in cc's, so which also means milliliters. So look at your packaging and see what syringe type that you have. And just for today's practice video, we're only going to use that 1 ml. I don't really need anything bigger than that. So I'm going to put everything else to the side and look at my needles now. I have 2 different needles. My packaging looks different than yours. I have a 5/8 needle. I want you guys to see, I don't know if yours looks exactly the same, but it is a 5/8 inch right here, but also I see 25 gauge. I told you guys that I wouldn't worry about memorizing your gauges because really the gauge and the length are going to sort of go hand in hand. So I have a 5/8 inch needle. My gauge, I'm not really worried about. It's going to correspond with my length. For today's purposes, probably going to use this 5/8 needle, but I also have in your package there, you have an 1.5 inch needle, because why? All of my adult patients have to have at minimum an 1.5 inch needle. It might go up to 3 inches if we're going to be giving it more volume in that vastus lateralis, for example. But even if it's a deltoid, all of my adult patients are getting this 1.5 inch needle. Really won't even fool with an inch unless we're talking about a kid, an infant or something. So 1.5 inch needle is what you're going to have in your packaging as well. So I'm going to put this off to the side. You're going to have 2 of each of those, so you need to go ahead and save 1 of each for your checkoffs because you don't know what you're going to draw to check off on, so you might need both of those needles. So I put everything off to the side right now, and I'm just going to play with my 1 ml syringe and my 5/8 inch needle. And I've got an alcohol prep here. I have a Practi powder, which is, you know, the powdery stuff that we're going to make a solution out of, and then I have a Practi vial that has just liquid in it. This one is distilled water that I have there. So I'm going to move those off to the side for just a second. First and foremost, what we're going to work with is just how to draw up some of our medication. And in this video, I'll probably use the terms medication or liquid interchangeably because that's what I'm talking about. I'm drawing up a liquid to give. So I'm going to use my little Practi solution here. First and foremost, I'm going to see if I can adjust this, you all. No, I'm not super tech savvy. Let's see if I can work this out. Perfect. Here we go. I have my little pad here, and here's my vial of medication. I have an alcohol prep wipe here. I have my 1 ml syringe, and then I have my 5/8 inch needle. So we're going to play pretend, and I'm going to give 0.5 mLs of a medication sub-Q. So that's my order. First and foremost, I want to get my vial ready here. So I've got my new vial. I want to make sure that with my alcohol prep, I am wiping the top of that off. I will be reusing an alcohol pad for today, so I'll leave that over to the side there. So I'm gonna let that dry there for me real fast. I'm gonna take my my 1 ml syringe here and open this. The one I have is a slip-on. It is not a lure lock like you guys have in your bags this semester, which is awesome. So you'll see this one just slips on and off, and it does not have the lure lock that screws on. So, but I'm still gonna work with this because it's still right here. If you can see, it's a 1 ml. So I'm gonna use that. I don't want to prepare medication with my needle that I'm going to use. So I want to use my blunt tip. And you guys have that in your bag also. It is the red one. That is your blunt tip that we're going to prepare medication with. So I'm going to slip this on here, and I'm going to pull my lid off and put it off to the side here. Because if you look at that blunt tip, it is just that, like I said, a blunt tip. You wouldn't want to inject that to anyone. You'll do a lot of harm. It has a slight bevel on it, but if you'll look in there, that gauge looks pretty big. And sorry, I don't have the packaging. So check out the packaging on yours to see what that gauge is. It's probably rather large. So like I said, I'm going to give a 0.5 ml. So I'm going to pull back my plunger here to my medication, and I'm going to go to 0.5. And you see we measure with that top rubber piece right there. So hopefully you can see that. 0.5. I have 0.5 of air pulled back. And what am I going to do with this air? I'm actually going to inject it now into my clean vial. So I'm going to inject that air. This will decrease my chances of getting bubbles back in, and make it easier to withdraw. So I am going to now turn my vial upside down. You always want to make sure that the bevel of your blunt tip is in liquid, right? We need to pull liquid back, so the tip better be in liquid. So I have mine pulled down a little bit, and I'm just going to start withdrawing liquid back. Now look, I can withdraw more than 5, right? Because I'm just going to push it back in there. This is all a nice little sterile area here. I'm leaking a little bit. So I'm going to pull back. I got to get up right here. I got a couple bubbles, so I'm going to go again. There we go. No bubbles that time. I went up completely up right there. If you got some bubbles, you can take a second to flick it. Or again, you can just push back and forth within your liquid because we have a sterile system there. So I have it there on 0.5. I'm going to withdraw that from my liquid. I'm going to do the one hand scoop method to put my lid back on. Now this blunt tip here, of course, we want to use this so we don't accidentally poke ourselves. So this is for med preparation and for our safety. So I want to go ahead and exchange my needle. Again, I'm doing sub-Q, remember? So I am going to choose this 5/8 needle. So that's going to be quite a bit shorter. That's one of our sub-Q needles, and it's going to have a little shorter bevel also. So move my packaging off to the side. Yours looks a little bit different. Yours has a lock that comes off to the side, and you might want to push that back out of your way because it might get in your way when you're actually giving the injection. And I'm going to pop that on. Again, I didn't put anything down. I didn't contaminate anything. So I need to get ready to prepare my medication. I'm going to take another alcohol swab here, and I'm going to prepare my site. Now, a little trick I do a lot of times if I'm preparing medication, especially at the abdomen, and I'm doing a sub-Q, and I clean my area, I might leave my alcohol swab beside it somewhere where I create a little arrow. This is my clean area right here. All right, so I have my area clean. I'm letting it dry. I've got my needle ready. I'm gonna pop the top off of that. Again, we're never going to recap this needle. Once I use this needle, I cannot recap it. So it's gonna go straight to the sharps after I lock it. So here I am ready for my sub-Q injection. Now I can see on the board I've written, I'm gonna give subcutaneous injections with a 5/8 inch needle at a 45 or 90 degree angle. Typically we're gonna do 45, or if you can grab enough adipose tissue to squeeze up 2 inches, then that would indicate they have enough subcutaneous fat that we could give it at 90 degrees. for the purposes of this video, I'm going to do it at a 45-degree angle. I want to make sure my bevel is up. This is my clean area right here. I'm never going to squeeze up to give any injection, right? I'm going to clean. I'm only squeezing to see what angle I need to give it, but then I'm going to let that go back tight. I'm going to stabilize my area though. So I have my spot here stabilized and it's clean. I'm going right here between the fingers. Then my patient's going to feel a little poke. We're going to go straight in at a 45-degree angle. And I'm going to use my finger here to hit that plunger and inject my medication. I'm going to come straight out here. I'm not going to do a thing until I lock this needle. This one's a push up here. I'm going to lock that. I'm taking this straight to the sharps, okay? Now, I will tell you for your practice purposes, you guys are going to have to reuse your needles, so you may not lock yours, but when you check off, you will lock your needle and then take it to the sharps container, okay? Perfect. So we have that one all set up there. We've locked ours and we're done with that, taking it to the sharps. Good job. I will go ahead and I'm just going to use my 3 ml really quick, and I'm going to withdraw 2 milliliters to show you a 90-degree angle. Again, I'm going to use my blunt tip here to prepare my medication with. I'm going to have 2 ml. So let's, I'm going to prepare this with some air first. I'm going to clean the top, insert my air into my vial, solid, and pull back that. Sorry if I'm out of frame a little bit. I had to pull back to my 2 mLs and withdraw that. Use my one-handed scoop here. Sometimes you have to go up against, there we go, to pop that back on and lock that. So I am here with my 2 mLs. So let's say I'm giving, let me see if I can prop back up here. I'm gonna give 2 mLs. Where can I give this 2 mLs? So again, sub-Q, I could probably do that, right? Because if there's no real max, it just depends. But usually we're gonna give out 1 ml. I definitely can't be given an ID. So this is probably an IM injection, right? I cannot give 2 in the deltoid, so I can't go over, and I wouldn't want to poke them twice and give it in one deltoid and then in another deltoid. So I'm going to choose this ventral gluteal. That's where I want to give this medication, because this is where I can give 1 to 3 mLs. So this is the site that I'm going to choose. Let's see here. I brought a model over here to show you the site before we do our injection here. So oh, this thing is rather heavy actually. So I have part of a body here. Let's see if I can frame a little bit better. So I want to feel for this greater trochanter here if I have my patient. So that would be, you know, basically the bony part of the hip joint there. So I want to place my palm of my hand here on that greater trochanter right down here. When I do that, I have my fingers spread out to the side here. Okay, so I'm basically spreading all my fingers wide. Between my pointer finger and my middle finger is where I'm going for, okay? So this is where I want to give that injection. Of course, on our mannequins, they are marked for you. When you look at them, you're gonna be able to see it plain as day. It's gonna show you the deltoid and ventral gluteal and the vastus lateralis. Just like this is right here where it has the vastus lateralis marked for us, but it didn't have the ventral gluteal. So that's how you find that with that greater trochanter. Spread your fingers and we're going right between the second and third finger. Put that off to the side, woof. And let's adjust back down here real quick to our injection. Okay, so we know we're giving this 2 mLs of medication. I am at the ventral gluteal because that's the only place we can give 2 mLs intramuscularly. So I have my site here. We found it already. I'm gonna prepare my area with an alcohol swab. My area there clean. Remember, it's going to the greater trochanter. Spread my fingers, so I'm kind of going this area right here. That's where I'm going to be. I have my medication prepared. I have my 2 mLs here, and I need to switch my needle though, right? I'm going to have to go to this 1.5 inch needle. So let's prepare this here. I'm going to switch this out. Whoops, that one pulled right off. There we go, fix that. And I have my 1.5 inches. So yours does it a little bit like this. I think it's a different color, but I wanna make sure I get this little safety out of my way. And here's my lid. Again, I'm not gonna ever squeeze up when I'm giving an injection. I'm going to pop my lid off here. I'm ready to go. I'm going in 90-degree angle, but I am gonna always stabilize my area. So we're gonna go straight down like a dart at a steady rate, straight in, inject our 2 mLs at a steady rate. Remove in the exact same direction in which you inserted, and lock your needle and put it in sharps. Okay, now, the one angle we have not looked at would be your intradermal, like the ID. I actually do not have, and neither do you, in your bag that is a small enough needle. We would like to use like a 3/8 to a 3/4 inch needle that has, you know, a tiny little bevel on it, but I'm going to continue to use this 1.5 inch needle for angle only, okay? So I would clean my area, and I am going to go bevel up at this, I mean, it feels almost flush angle to put that bevel in and then insert your liquid and come out in the same direction. I'm going to try to slant this a little bit to see if you can see the angle a little bit better. So it's just almost flush with that skin. So I just wanted you to see that angle. But again, I'm all done with this, so I'm going to lock it up. Now what we're going to talk about is reconstitution. So we're not going to give any more injections. I've actually locked all of my needles anyway, and let's just get those out of here. But let's talk about reconstituting these needles, or I'm sorry, reconstituting this medication. I have a flush right here. And I know I've shown everybody that anytime we're working with a flush, we want to get the pressure out of that. So I'm gonna get the pressure out of my flush. I'm gonna lean over to this trash can here and just push that. So all you're doing to get that pressure out is just barely giving it a push here, right, to get some of that pressure out. But I don't wanna lose liquid, right? So don't push so much out that you're losing a lot of volume. I still wanna keep my 10 ml of my syringe there. And I put that lid back on. I want 10 mLs because that is what my order is going to tell me to mix with this medication. Now, a lot of times when you go to the Pyxis, it's going to give you your powder antibiotic, and it's also going to have you get out a vial of saline that's 10 mLs. So you could theoretically get an empty, you know, a 10 ml syringe, open it, use a blunt tip, withdraw the medication. Actually, I've got an empty one over here, I'll show you. So you could essentially use your blunt tip, clean the top, withdraw your 10 mLs here, and insert it into here to prepare your med. The reason I'm going to show you how to do it with a flush is because that's how you're going to see it done in the hospital typically, and I want you to see a little bit of reality. So I'm going to use my new flush. I just got the pressure out of it. I have my blunt tip. I'm going to apply that to the end there. I'm ready to go with this. I need to pop the top. Even if you just pop the top and it's good and clean, you know that, I still want you to make a good habit of cleaning that top there. So now I'm taking my flush, it's full, 10 ml. I'm going to insert my blunt tip into my Practi powder, push all of that in. As you see, I let go, and it's starting to fill back up, that pressure in there, and it's all yellow, right, because it's mixing. So I like to push up and down, if you can see what I'm doing, push and let it go up, push again, let it come up. That turbulence kind of creates, it mixes it up for you when you have that turbulence, but you really want to push it all in, hold the plunger in with your thumb, and shake it really good. Let me give it a little shake here. Shake, 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 shake. And I can see now that I have all of my liquid. So I'm going to let this go, and some of it, well, it's not going to pop up anymore. I'm going to turn it upside down, and I can start filling my syringe back up. So now what I have is reconstituted medication in this vial. I'm going to go ahead and push all that back in, because all you're going to do with that is you just created yourself a little yellow mixture to practice injections with. Like I said, if you're at the hospital, this would be now your medication that you just mixed, right? So you're just going to use it for practice purposes. But I wanted you guys to see what that reconstituting is going to look like. So let me snap that back on there. And clean up my area just a little bit. And we are going to do, last but not least, an ampule. Now, you probably won't use an ampule very much, but you get them in your kits. They exist. I want you to see it. So you're going to look at your ampule here. Obviously, it's glass. Sometimes you might have a little liquid stuck up in the tip there, and if that's the case, just turn it upside down a few times and try to get that liquid all back down. I think I just put some in there, so let me try to get this down. Okay, I just shook it really good, and I gave it like just a little flick, and it popped right down. So now I have all my liquid here, and you're gonna see you have this little blue ring around the top. Where's the best place to see? There we go. So what that little blue ring is on mine, I think some of yours might have a blue dot actually. So when you try to crack this ampule, that's where it's going to break. So that's where we're looking to crack this ampule. So I have my gloves on for safety. A couple of mistakes that students make often is as they push this through, and that's how you're gonna hold it. You kind of hold the tip up here. You put the pad of your thumb around the thickest part of the neck, and you give it just a little snap, and it just pops right off for you. Some students make the mistake of aggressively popping that, and they cut their finger then on the broken glass. So there's no need for that kind of aggression here. The other mistake people make in class sometimes is they'll, instead of snapping it off, in a downward motion or right in front of them, they'll kind of get scared then and snap off to the side and hit your neighbor with a little shard of glass, and that's not cool. So be sure that we're very safely pointing our ampule down to our table, our working space in front of us. So I'm gonna go ahead and get my 2x2. We're definitely gonna use a 2x2, and I encourage you to use gloves as another added protection. I'm going to hold my 2x2, see on the top here, I'm gonna hold it with my little pointer finger. I'm gonna put my thumb then. Again, I'm looking for the biggest part of the neck, the thickest part at the bottom there. I can feel it with my thumb. So I'm sort of holding that, and all I'm gonna do is a downward motion to snap. I'll try to be quiet so you can hear it. There it went. Sorry, I had to pull up just a little bit. So I have now cracked my ampule, and it was a pretty clean break. But if you see here how it's a little jagged, if you pushed your finger through too aggressively, you could very easily cut the like your nail bed on that. I think these are cool too, because I can turn this ampule upside down. It's like a Dairy Queen Blizzard. So yeah, so if you were going to withdraw medication out of that, it's a good practice for the ampule just because of that broken glass to keep it down on the ground, on your working space there. And we're going to insert our, and try to withdraw that way without holding it up so you don't cut yourself. So I just withdrew all my ampule medication into there. I still had some yellow left over from my previous mixture, sorry. So yeah, that is your ampule. So now we have looked at everything that is in your skills bag. Let's just talk for one quick second about what all the things I've written on the board. We're talking about our intradermal here. So pull that just a little bit. Our intradermal, it has a volume max of 0.1. We want to use 0.1. Let me see if I can find. So use needle here. So 0.1, can you all see that? There's 0.2, 0.1 is way up there. Look how tiny that is. You see how it would be difficult to give 0.1 in this bigger syringe? Like there's 0.5, but it's just really too big for me to try to give such a tiny amount. So I would never use this 3 ml. I'm gonna use my 1 ml syringe. So you always wanna use the smallest one possible. So for our intradermal, 0.1 ml, 3/8 to 3/4 inch with a short bevel. Now you all do not have that size needle in your pack. You'll have to practice with your 5/8 inch. And then we want to give that at a 5 to 15 degree angle. Those are typically done, on the arm. You think about those TB skin tests that we do. Subcutaneous. You usually see a 1 ml, and that's kind of what you guys will mostly practice with. But again, if you see larger patients, sometimes they might be able to take more than 1 ml. But typically speaking, it's about 1 ml. Not a test question, just want you to know. The needle size we want to see here, typically the 1/2 inch to the 5/8 inch. What you all have available to practice with is your 5/8 inch. That's what you're going to use. We're going to always insert that at a 45-degree angle unless we can squeeze up, you know, that at least 2 inches of that subcu tissue. If we can squeeze that up, we have enough subcutaneous tissue that we can go in at a straight 90-degree angle. Subcu, you're typically going to see given in the abdomen. That's the best place. I think we talked about in lab theory, like there's not as much activity in that area, so it tends to absorb more evenly in that area. But it can be given on the back of the arm, even on the side of the leg, if you can squeeze up some subcutaneous there. IM injections, they are different volumes depending on where they are given. So if you have an order for 1 ml, you're going to give that in a deltoid, and it's kind of hard to do on yourself. But if I would come here to this acromial process, it's called this bony part of my shoulder, and I want to come 3 finger breadths down, and then make a little triangle, and I want to give my injection right there in that deltoid spot. So my deltoid be 1 ml. You're typically going to see, you know, like vaccinations given there or something. Ventral gluteal, again, that's where you place on the greater trochanter, and you spread your fingers, and we're going to give it in between those two right there. That can hold 1 to 3 mLs, and then your vastus lateralis, the side of the leg, that can hold 3 to 5 mLs. We're always going to use at least 1.5 inch size needle on adults. If we're going to go in the vastus lateralis, we're going to definitely use a 3 inch, and that's always given at a 90-degree angle. So that is basically a really quick version of your injections. The one other thing you're going to do in lab is you'll be connecting your one of your syringes to an IV extension tube and doing like a little flush or medication IV push bolus. So that's one other thing you can practice that I didn't show here. But yeah, that is a quick version of injections. So hope you enjoyed. Have a great day.